Hi, and welcome to Cancer News for You. I'm practicing medical oncologist Dr. John Salter. I currently work and reside in Indiana, and if you have any additional questions about me, check out my website at saltermd.com. Cancer News for You is my invention, hopefully my opportunity to reach out to my patients, to families of patients, to other care providers, to people who are just generally interested about cancer news. There is a lot of media, and there are a lot of sources where you can go for cancer news, and I hope that this opportunity is just one more place where you can go for very reputable, slightly biased, but hopefully interpretable information about cancer in the media today. I'm going to bring you two stories today, both of which came out of the New England Journal of Medicine on October 25th, just last week. One story is about how cancer patients often misinterpret the benefits of chemotherapy when they have terminal illness. The other story is about how aspirin may be a very useful adjunct in the treatment of patients with colon cancer. The first story looked at approximately 1,200 patients with stage 4 colon or lung cancer. Now let me set the premise by saying that patients with stage 4 lung and colon cancer generally are felt to have incurable diseases. There are a few cases where these patients can be cured, but chemotherapy alone is never adequate enough to do the job. These patients were then asked about 4 months after they were diagnosed and all receiving chemotherapy, whether or not they felt the chemotherapy they were receiving had any potential to cure their cancer. Patients' responses were then analyzed for any correlation between factors such as cancer type, race, age, and socioeconomic status. If you look at this figure, you'll see that approximately 70% of lung cancer patients and 80% of colon cancer patients on this study felt that chemotherapy had some chance of curing their cancer. Factors associated with the misconception about chemotherapy benefits included having colon cancer. That is, these colon cancer patients were more likely to believe that chemo could cure them as opposed to the lung cancer patients. Race did play into the effect, and more importantly, or at least interestingly in my mind, is the fact that patients' perceptions of their doctor's communication skills inversely correlated with their misbelief that chemotherapy could cure them. What that basically means is that the better patients felt their doctors did at talking to them, the more they misunderstood the real benefits that chemotherapy could provide. So this then begs a logical question: why do so many cancer patients have misconceptions about the benefits of chemotherapy for their terminal cancer? Are doctors just failing to convey the right message? Are we just misleading patients? Are patients just clinging to hope that maybe is false? Or is it something a little bit more devious? Could it be that doctors are intentionally misleading patients to preserve their business and their reputations? Now, speaking for myself, I would never ever mislead a patient intentionally. But you can see where in a fee-for-service industry, that is, where doctors are paid to see and provide care for patients, why it might be advantageous to tell patients a message they want to hear. If I tell you that there's a chance, even a small chance, but a chance that maybe I could cure you, you may be more likely to come back to me for your treatment. On the other hand, if I tell you very plainly that there is no chance that chemotherapy could cure you, you may go seek out another doctor who will give you that potential message, and thereby continue to give that doctor your business. So I do think this is a very, very important issue, and I'm glad the study was done because I think it opens the doors for discussion. So I would certainly invite anybody who watches this video to put in the comment section down below or send an email message about how you felt or interpreted this information. Do you think doctors have an obligation to tell patients very plainly and truthfully about the potential benefits of chemotherapy? Or is it okay to hold out a little bit of hope, giving patients the sense that maybe there's some chance they can beat their cancer with chemotherapy? And you're not necessarily misleading them at all. It's just something that you might make a better sales pitch, or it might just make you seem like a better or nicer person. The next study, also from the New England Journal of Medicine, asked the question, what does aspirin add to the outcomes in patients with colon cancer? Now, we've known for years that aspirin is a useful drug in the treatment of colon cancer, but we haven't been able to determine just why that is. So researchers went about looking at a specific gene called PI3K to determine if somehow this gene contributed to the outcomes in patients with colon cancer. And what they wanted to know was, if you have a mutated version of the PI3K gene, was there some advantage for you taking aspirin versus those patients who were not taking aspirin? Now, mutations in this PI3K occur in about 15 to 20% of colon cancer patients, so we are talking about a fairly reasonable group of people. So the researchers looked at 964 patients with confirmed colon cancer, and these patients were taking aspirin routinely at a dose of approximately 325 milligrams a day. This is a full aspirin as opposed to a baby aspirin. Tumor specimens were then also analyzed to determine the mutational status of the PI3K gene. And when they compared aspirin takers versus non-aspirin takers in patients with a mutated version of the gene, they saw a tremendous difference in both cancer-related mortality and overall mortality. What this means is that if you have colon cancer in a mutated PI3K gene, aspirin can reduce your chance of death due to cancer by 82% and can potentially reduce your overall chance of death by 46%. However, there was no difference for those taking aspirin in the group who had the normal or wild-type PI3K gene. So this begs the question, is aspirin the next targeted therapy in colon cancer patients with mutated PI3K? Now you could ask, why aren't we checking PI3K routinely in all of colon cancer patients and then putting those patients with a mutated version on aspirin? And while that seems logical, you have to remember that most of these genetic tests are not cheap. And we're going to screen 5 patients, roughly, in order to find one patient with the mutation who would then benefit from the aspirin. Since aspirin is so cheap, and for the most part very well tolerated, one could logically argue, why don't we just put all colon cancer patients on aspirin, so therefore the 1 in 5 who does end up having the mutation will actually gain the benefit, and the other patients probably won't have any significant detriments. I would favor the latter approach, and I don't have any problem putting colon cancer patients on aspirin as long as there's no contraindication, as long as they don't have stomach ulcers or an allergy or a history of kidney disease or some other reason why they should not be on that medication. This seems like a pretty logical reason for patients with colon cancer to go ahead and take a daily aspirin as long as their doctor endorses that move. So that's all I have for this episode of CN4U. I would encourage folks to get back with me about any questions you have about the studies I cited, about any comments, concerns, controversies, any of those sorts of things. You are welcome to email me. There's an email address on saltermd.com as well as a link down below this video where you can post comments. You can find me on Twitter. You can find me on Facebook. You are certainly welcome to call the office and make an appointment if you do live in the central Indiana area and you'd like to see me as a patient. I hope you've enjoyed the video. Thanks for watching, and I'll look for you next time.